Welcome to yet another episode of Health Check, and today we are going to discuss about prenatal care. Please grab a seat if you are expectant, because this conversation is going to be very important not only to you but also to your unborn child. Karibu. What should a woman do once she finds out that she is pregnant?
Every pregnant mother is seen at least once within the first 3 months. That usually allows us to be able to have a fair idea of what their condition would have been prior to pregnancy, and which then forms a basis for us to evaluate changes that will be taking place during that pregnancy to decide whether they are within normal or we are going out of normal. When they come late, we may not know where they were. Of course, the ideal situation would be that, in fact, before we go to prenatal care, we should probably start with the pre-pregnancy care. Because then,
Pregnancy being
before the pregnancy sets in, the idea is that we evaluate the mother's situation, mother's condition, to establish that she is in the best possible health to be able to carry a pregnancy. But short of that, then an early visit gives us the closest possible idea to what she could have been before that pregnancy.
Yeah, so the first 3 months you find morning sickness, a lot of people are complaining they're tired and all that. Why is it that is happening?
Basically, as pregnancy sets in, the system produces a lot of hormones way beyond what would have been usual outside of pregnancy, and is the body's reaction to these changing hormones that will give those symptoms. And the symptoms again will be variable between individuals, and even in the same individuals they can vary with different pregnancies. For us, for as long as they fit in with what we would expect, I think we would consider that to be usual. Right, so that one need not respond the same way to each and every subsequent pregnancy. There can be variations, but that generally they're just a body's response to the changes in the hormones.
What medicine are they given at that time?
Usually it depends on what wants to achieve and based on the specific complaint that will be there. Obviously, we would want to control vomiting, and we would want to try and ensure that the mother is able to feed properly, and would want to avoid a scenario where there is any nutritional deficiency. And so most of the medicines would be targeted largely at preventing vomiting and perhaps also boosting appetite, and probably also providing the micronutrients, which are the ones who would suffer a deficiency from earliest in situations where the mother is not feeding well or is vomiting. Right, so we would target largely controlling nausea and vomiting, plus any other of the symptoms that could come up.
Prior to being pregnant, probably someone had other illnesses. So why is it that most of the time, or at times, they're taken out of their medication?
Majority of times, it will not be so much that we take them off the medication completely, but rather try to look for and change them to those that would be known to be safe in early pregnancy.
Why is it that some women are depressed during pregnancy?
Largely, again, the reaction to the pregnancy itself, and perhaps also the change in the hormones within the person. Sometimes it may be a pregnancy that had not been planned for, and so apparently causing disruption in one's life, and that can bring about challenges in adjusting to it. Equally, in scenarios where one was actually also not prepared for this pregnancy, and perhaps equally not prepared for the changes of pregnancy. These are the chemical level, and so all these things that one is feeling, if one interprets them negatively, then obviously they can lead to an element of depression. But even at the physical level, people would respond to the pregnancy changes differently. For instance, even if we're just looking at the skin, the changes in skin, there are those who would have, the skin becomes smooth and nice. Perhaps they will be more comfortable. For others, the skin may become rough, freckled, pimpled, and so that changes their self-image and it can have an impact. Likewise, even the change, I know there are so many women who are very eager and happy to see the bump develop. But there are those who will look at that loss of their perfect image. That becomes a threat, a challenge to their inner self, and that can actually lead to an element of depression. So it depends, therefore, largely on whether this individual was prepared and whether this individual has an idea of some of those changes and how they interpret those changes.
Is there something that can be done at that time when, let's say, someone is depressed?
Yes. Usually there will be two levels of approach, and again subject to the level of the depression. Obviously we will start with counseling to get one to appreciate why what is happening to them and what is expected, and to appreciate that this change is transient, it's there for a limited duration of time, and it will be over and they'll go back to their normal self. To some, that might be sufficient. Again, obviously, over time, even the same changes are perhaps constantly altering, specifically in relation to the hormones. So that in itself, that appreciation that this is a change that is there for a short while, could help them to come out of that depression. But those who are severely ill, to the point that perhaps even need to be admitted to hospital, then obviously there are medication that they would need to be given. And at this point, usually we'll manage such patients in consultation with our colleagues from the area of psychiatry.
Why is it important that pregnant women should be taking folic acid?
Generally, folic acid provides one of the raw materials that are required in the formation of DNA, which we know is important in the process of cell division. And that from studies that have been conducted previously, it had been documented that deficiency of folic acid has been associated with some malformations involving the nervous system. And so when we use it, we essentially are trying to enhance the process of organ formation and prevent the risk of congenital abnormalities.
Or for the fetus and for...
That is largely for the fetus, particularly in early pregnancy. Of course, in the later parts of pregnancy, the same folic acid is also important in the formation of red blood cells together with iron, so that then we would use it in the prevention of anemia during pregnancy.
So if a woman didn't take folic acid, what are the dangers?
Much would depend on whether, in fact, then she was having a normal diet that has got fruits and vegetables. Chances are high that she would still have gotten adequate amounts of folic acid from the the diet. We would usually give the tablet form to guarantee that we actually do have enough, but that most diets that have fruits and vegetables that are not overcooked would still provide adequate amounts of folic acid. And so it shouldn't throw one into a panic that you've done your first trimester, you hadn't taken. For as long as the feeding is fine, then we will presume that we actually did get enough.
During pregnancy, some women lag off when it comes to diet. So what advice can you give to them? So what should they do to stick to a healthy, balanced diet?
Generally, in early pregnancy, we would not insist, because those cravings would be, to a large measure, dictated by the hormones. And you will find that by insisting on a balanced diet, we may actually cause this mother now to perhaps vomit and end up losing everything. What we do know is that the requirements, particularly for the forming baby in early pregnancy, this is an individual that is still almost microscopic, extremely small, and so the requirements then are equally that small. It's not very easy to have a deficiency that would severely impair the growth. Again, over and above that, the placenta has the capability of extracting most of what the forming baby would require from the mother's system. And so, whereas we're likely to have the deficiency more on the maternal system, on the fetal system, more often than not, the placenta would ensure still the fetus would get about enough. We would want then to focus more on the balanced diet when we have gone beyond that time where, choice is limited on account of the effects of hormones. Once those effects are worn out with the first trimester, perhaps that is the time then we will want to focus more on a balanced diet.
And you find someone is pregnant but still they abuse drugs, they smoke. So the consequences, what are the consequences to the fetus?
Most drugs, and particularly smoking, can have effects at two levels. If it's very early in pregnancy, potentially it will be associated with some errors in the formation process, so that the baby could have some deformities. But late in pregnancy, they would tend to be to affect the efficiency of the placenta, so that the baby can fail or end up undergrowing what we call intrauterine growth restriction, so that the baby would be small for age as it is growing within the pregnancy. Obviously, that, if severe, can actually lead to baby dying while it's still in the uterus. Some substances of abuse, and including alcohol, can also lead to the baby developing withdrawal symptoms at birth, much the same as maybe adults develop when they are being taken off those addiction drugs. And those withdrawal symptoms, unless recognized, can actually also be life-threatening. And so the effects would vary dependent with the circumstances where we are in the baby's life.
So, how, once a baby is born, how do you know that they're going through the withdrawal system? How soon is it discovered?
It would be, when the baby was inside the mother's womb, was constantly in contact with the mother's blood. And so a good number of the substances with the mother's blood would be also getting the baby's blood. Now, within hours, probably 4-6 hours after birth, the symptoms could potentially set in. These may manifest with things like irritability, baby who is apparently not comfortable, crying, probably not breastfeeding, or over time, because then if it's not breastfeeding, it could also now develop lethargy. It's not active at all, but initially it will be that irritability, and in some cases could even develop convulsions.
What causes stillbirths? You find probably someone they took pregnancy, they took care of themselves well, but still their stillbirth occurred. Why?
The varied reasons, and some can be predictable, others totally unpredictable. There will be instances where we are able to identify causes, and there can also be instances where we do not find causes. Amongst the known conditions that can easily cause stillbirths would include diabetes, if it is not well controlled or undiagnosed. And in either case, diabetes can cause a stillbirth, either when the sugars overshoot or when the sugars in the mother go too low. And this has been known to happen usually late in pregnancy, when suddenly the baby would die. Babies can also suffer stillbirth in relation to hypertensive disease of pregnancy. Many times again when it is out of control, but occasionally even in situations where we think that the control has been fairly okay, it's been known to happen. Usually through interference with blood supply through the placenta. Again, babies can die from accidents involving entanglement with the umbilical cord. Sometimes the babies can tie themselves either around the neck or around a body part. It can be the trunk, it can be an upper limb or lower limb. That may have an effect of stretching that umbilical cord and again interfering with blood flow. Obviously, if a mother becomes sick again with some conditions, maybe malaria or those conditions that are associated with fever, that can also put the baby at risk for stillbirth. But there are also situations where it does happen and we check and we are not able to establish exactly why it has happened.
How about miscarriages? Like, what causes it?
Again, varied causes, and that may also vary with the duration of pregnancy. If we are looking at perhaps the first 2 months of pregnancy, the commonest cause will be errors in the formation process, so that a mother system is able to recognize a situation where whatever is forming may not be compatible with life externally, and in the process reject that. The next commonest cause tends to be insufficient hormonal support. That usually the system is supposed to generate sufficient hormones, particularly progesterone and the hormone estrogen, that sustains that lining into which the baby will have embedded. If that is not sustained with adequate supply of hormones, it can actually shed off much the same way it shades off administration, and in the process actually lead to miscarriage. Over and above that, any other ailments the mother can actually contribute, including chronic conditions like the same diabetes, hypertension, and for as long as the conditions are not controlled, they can have an effect along the way at whichever point. Then, as we go in the second trimester, we could also have issues related to the structure of the uterus itself, including the cervix. In scenarios where there's a weakness in the cervix, it's supposed to maintain tightly shut to maintain the fetus or pregnancy within the uterine cavity. If it is not strong enough, as the pregnancy grows, the cervix begins to open and can let the pregnancy out. If we have any growths that interfere with that inner cavity, inner space within which the baby is supposed to be growing, again, that can lead to pregnancy loss. Such interference can include things like fibroid that is growing into that space, can also include anomalies related to the formation process of that uterus, so that perhaps it's not one complete cavity. It could be one that is subdivided either completely or partially into two as part of an error in the formation process or incomplete formation for that matter. Largely, that would tend to be the scope of varied causes, but that illnesses in the mother will actually also contribute. Then there can also be causes related to perhaps the immunological system. The body defense system, how it recognizes this pregnancy. There are a number of conditions that can also lead to a rejection reaction, so to speak.
So, is exercise allowed during pregnancy, and if yes, what type of exercise should they be doing? Important is the exercise during that period.
Some exercise is useful at all stages of life, including pregnancy. The overriding principle being that you need to keep fit. A fit body then functions best. For purposes of pregnancy, usually we know that a mother who would approach perhaps the delivery time when they are physically fit, they are likely to cope with the labor process better, and perhaps even go through the delivery process better than a mother who is physically unfit, because delivery usually demands a lot of energy. However, we are also aware that pregnancy would cause some changes in the mother's system, which when exposed to high impact exercises, they can be at risk for self-injury. And so, as much as we say we want exercise, we also want exercise that would still be safe for the mother. We know that particularly as we go in the later parts of pregnancy, there's quite an element of instability, particularly within the joints in the pelvic region. And so we would be most comfortable with walking and perhaps swimming as the main exercises, particularly as we approach the later parts of pregnancy, because we know this, the risk of perhaps falling and injuring itself is minimal. of course, some lift-ups, some element of weightlifting, to tone up the arms, that would still be okay because it doesn't put a lot of strain within the joints.
Okay, what are the do's and don'ts for pregnant women?
The do's. We start with self-care, beginning just at the level of normal hygiene, because when a mother's body is healthy, it provides a healthy background within which the baby would grow. So hygiene, self-grooming, feeling good about oneself. The next level is seeking care, so that we know there are some conditions that can be present but not giving symptoms that would make one know that all is not well, and that cannot be determined when they are evaluated by a medical practitioner or health worker for that matter. And so what you need to remember is that as per the recommendations of the Ministry of Health, that we need to have our first visit within the first 3 months of pregnancy. It is not waiting for the 7th or 8th month. We need to start early. Usually then one will be advised by the health worker, subject to their specific circumstances, how often. Generally, where we do not have significant risk factors, we can give wide intervals for regular checks. Importantly again is for the mother to appreciate and understand some of the things that can go wrong, so that they are participants in their own care. This is a duty upon the health workers to educate the mother so that they are aware of some of the risk factors during pregnancy, during childbirth, and even post-delivery. Again, importantly, it is planning for that pregnancy. One needs to be able to identify where they will deliver from. One needs to identify perhaps support partner. One needs to put aside the resources to finance the same pregnancy process and delivery. I don't know about the don'ts. The don'ts, we've already said. You have to know that you are the background, you're providing the background within which the baby is growing. And so, some of the things that will make that background unhealthy, we would need to avoid. For those who are smoking, for those who are taking alcohol, we would recommend that if one can't actually stop, one significantly reduces that. In the context of exercise, we've said yes, exercise is good, but caution has to be brought in, particularly when you're considering the high impact exercises. Take good care of your nutrition, and I think all will be well.
Join me next time on our next episode of Health Check with me, Malasen Abdullahi, as we get to discuss more health topics. Until then, stay safe.